All right, thanks, Audrey. Today we decided to talk about water aerobics. Our initial thought was to do it in the water, but then we realized how complicated that would be for you to even see the movements. I will talk about water aerobics, the benefits, and then talk about exercises that you can do in the water. We'll go to the next slide, Audrey. What is water aerobics? A lot of people think that in order to perform water aerobics, you have to go to a specific class to do a certain routine. And while that is an option, water aerobics is a series of exercises performed in the water. So you can do it on your own or in a class. It's designed to help improve our cardiovascular health, strengthen your heart and lungs, as well as increasing muscle endurance. By moving against the water with the movement, you are bringing up your heart rate, working your cardio, and you're increasing your muscle. It takes a lot of work to move that water around your body, and it is a non-impact. Water aerobics is typically set up of a series of exercises that you perform repetitive movements. It can be a full body thing. You can do your arms, your legs, full body into one movement. A lot of great core exercises as well. As always, check with your doctor to see what limitations you might have. In the past, when I've worked with a lot of cancer patients, water aerobics was the #1 activity that their doctors recommended, unless they had a port. If they had a port, they said no. But other than that, it was an exercise that we could have our patients do. Because it's a non-impact exercise, it is really beneficial when you're experiencing fatigue and bone pain. Depending on the water temperature, it can actually help increase your blood circulation as well. So then it can help reduce some of that like heavy leg feeling, reduce cramps, and actually improve lymphedema as well. All right, we will go to the next slide. So benefits. Our regular water aerobics can help build and tone your muscles. Low impact exercises and underwater movements are ideal with joint pain. Depending on how you do the movement, there's arthritic type movements that is really beneficial if you experience arthritis. It's more of like a slow, think like Pilates or yoga in the water. Obviously not going down, but just really slow, methodical movements. It can help increase that movement in your joints while reducing that inflammation and pain. The continual movements can help with your heart health, and regularly increasing your heart rate for extended periods of time boosts your cardio health, and it'll give you more energy and help you be able to manage that chemo fatigue. And as always, performing exercise increases your endorphins, and it can help lower the risk of depression. Water aerobics can be done. So when it says a repetitive movements, it doesn't, a lot of times with strength training, people say, how many repetitions do I need to do? And so it's typically 8 to 15 repetitions of an exercise. With water aerobics, it doesn't have to be so specific. It's more of amount of time of doing the movement. So when you do water aerobics, if you're doing it at home or on your own, if you can go to a community pool and do some water exercises on your own. A lot of pools, community pools, have a timer, either by the lifeguards or up on the wall somewhere, and you can time yourself for the movements. And that can be kind of your challenge, is that if you can do that movement for 10 seconds, then next time try for 15 seconds. Next time, try for 20 seconds. You're working on building your muscles through fatigue in the pool, but you don't want to overextend yourself. So as always, when starting an exercise program, you want to start slow and you want to start low. So starting slow means not going full intensity. So for example, if you're doing a bicep curl, you're bringing it up and down through the water. You're not going to be going fast, 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 fast. That would be complete opposite. You want to go push the water down, pull the water back up, doing a slow 1-2 count down, 1-2 count up. It's going to put your muscles time under tension. So that's going to help increase your strength as well as muscle endurance, which is very important when dealing with a lot of chemo fatigue. And so it's better to time yourself for amount of time rather than focusing strictly on specific repetitions. And then that way, as you continue to do the water aerobics, you can challenge yourself more on, today I'm going to try a little harder. I'm going to do this for so many seconds, those kinds of things. All right, next slide. How to do water aerobics. Do you need to go to a class? No, you can do it anytime, anywhere. Classes are great. Instructors are awesome. They have a lot of energy. They have a lot of experience. They have great music, and you can meet a lot of great people and friends in those classes. However, not wanting to go to a public pool or class schedules can be an issue. So there can be other conflicts. So you don't feel restricted to having to do a class. You can go on your own. And it's something that you can do if you have a pool for yourself as well. Equipment, really, you just need to have a body and a swimsuit. You don't need a lot of equipment to do it. Some great things that you can use in addition are foam dumbbells. Most community pools will have them. It's like a PVC pipe with 2 foam wheels on them. They're float belts so that you can do some water jogging in the deep end without having the impact of the bottom of the pool. And you can do a lot of great core exercises with a float belt or even a pool noodle. The pool noodle can often slip out from under you, so a float belt that clips on is typically a little bit better, more stable, but both will challenge your balance in the water, but also help keep you afloat, reducing that impact even in the pool. All right, so how do you know what to do? So here are some ideas. So what I'm going to do is I'm going to talk about the idea, and then I'm going to step back and show you a little bit. Audrey, tell me if you can't see me when I step back. So jogging in place, fairly self-explanatory. It's as if you're doing a jog. You want to get your arms into it and moving your legs at the same time. Jogging in place is an awesome warm-up exercise when you first get in. So I recommend a lot of people doing a couple minutes or a minute of jogging in place or jogging back and forth. So a lot of times, if you're in your own pool or in a community pool, there's just a short distance. You don't need to go very far, just kind of doing a few jogs out, a few jogs back. To kind of help warm up your whole body. You're engaging your core, you're getting your legs moving, and you're getting your arms all warmed up. Then going into jumping jacks. Jumping jacks, you can change your intensity as you do it, just like on land. So you don't have to bring your arms all the way up. So if you have shoulder issues and you can't raise your arms all the way high, don't worry about that. That is not going to be an issue. So with jumping jacks, you can do both legs out at a time or alternate stepping out. So bring it down. So with jumping jacks, you can go out one side at a time. As you raise your hands up to water level and back down, you're going to strengthen your shoulders. And stepping out, you're still getting that benefit of working your abductors and adductors. Or you can do out, in. Either one works. Then there's the walking laps. So making sure that you, with a walking lap, do your arms down. That's going to really engage and work your shoulders. It's actually a really great workout. And then we have cross-country skis. This one and rocking horse are both really fun to kind of alternate. Rocking horse is a lot easier to do in the water than not in the water, but I will try and show both of those. Cross-country skis. So you're gonna straight arms, straight legs, kind of swishing back and forth. Rocking horse, your hands will go up at the same time, leg back. You're gonna pull the water against you and go forward. So you're rocking back and forth, bringing you the water down, bringing the water back up as you alternate side to side. Then you'll switch legs. Again, same thing. It's really hard not in the water. All right, high knees, just as it sounds. Again, it does not have to be high intensity. You can be picking up one leg, bringing it down, picking up the other leg, bringing down. That helps improve your balance, as well as engage your core. So with high knees and butt kicks, you can also hold on to either the side of the pool for stability or to a pool noodle. So having a noodle out in front of you while lifting your knees up or kicking your bum can help. So if balance is an issue for you, that is a great way to support yourself while challenging your balance. Bicep curls and tricep extensions can both be done at the same time. So you can see my arms here. So you'll do a bicep curl here, keeping your palms or turning your palms down, tricep, bicep, tricep. Excuse me, dry my mouth. And then we have jabs and shoulder circles. Sorry. Jabs is going to be punching the water, pushing it forward. And then shoulder circles is how it sounds. Circling in the water, you'll go back, and then you'll go forward. And it helps engage your chest as well as your shoulders. Then we have chest flies and reverse flies. So this, kind of like the bicep curls, can be done at the same time. So chest flies, palms facing forward, bringing the water, swishing the water forward, and then reverse fly, bringing it back. Forward and back, forward and back. So it's really, sorry. It's about engaging that mind-muscle connection. I apologize.
Are you okay?
I'm okay.
I wish we were closer so I can help out.
No, it's okay. My throat got really dry and now it's like itchy.
Okay.
Alternating kicks is kind of like the walking laps, but kicking up high, straight leg. Sumo squats is just a wide squat, just a short range of motion. Straight leg walk, that's actually the high kicks, but moving. Ooh. Straight leg toe touch and uppercuts. So the toe touch is reaching for your toes. So opposite hand, opposite leg, reaching for the toes, switching sides, reaching, really engaging your core. Uppercut, similar to the jab, but you're bringing the water up, up, up. So really bringing it up, and similar to the bicep curl, it's really going to engage your biceps and get your core. So the big thing with a lot of these movements is to make sure you're not rotating. There's no need to be doing twists. Keeping your core tight through the movement can help support your core and not tweak your back. Hammer curls are great if you have the foam dumbbells, but it's a little bit hard to get the full benefit if you don't have the dumbbells, because the hammer curl your hands this way instead of having the palms up and down that work as resistance in the water. So if you have the foam dumbbells, it works a lot better. And then walking forwards and backwards. So walking backwards helps with your coordination, and it helps engage your posterior chain, your hamstrings, and your glutes, as well as your calves in the water. So a great way to kind of do a routine is maybe pick a few of these exercises and do them for like 30 seconds each and do it again. You don't have to go through all of these exercises to do a workout. You can pick some and do those and then do the other ones on another day. All right. Questions, so that I will stop talking for a second.
Let me help moderate those so you can get a drink again. First of all, that was great. And again, as Linnley said, initially we were like, oh, let's film this in the pool. And then very quickly we realized what a poor idea that would be, because you wouldn't be able to see what she was doing. So I think this was a great way to shift things, Linnley, and you did an excellent job. Thank you. So one of the first questions here is, you mentioned in the beginning that people with a port aren't really recommended to do kind of pool activities. Why is this?
It can get infected.
Okay. Awesome.
So open wounds or ports, it can get infected. There are some like bandages that are waterproofing type thing, but doctors just say it's best to just not even try until it gets down.
Yeah, not worth the risk. Interesting. Okay. Linda has a good question. She's wondering if water aerobics can be weight bearing. She aqua jogs without a flotation belt. I think that means maybe with a flotation belt in deep water for 45 minutes. Was told that's not a weight bearing exercise. Also does yoga and hand weights, but doesn't enjoy the gym or machines.
So Linda, are you wanting it to become a weight bearing exercise?
I think that's what I'm getting from the question.
Okay, so you can. So I would say do part of your aqua jogging in the shallow. So you can do it in the shallow end where you're actually touching the ground in the shallow, but you're not getting the full impact of jogging outside. Because the shallower you go, the more gravity, I guess, you're gonna experience. And then if you're going the fully deep where you're not touching at all, you're completely weightless. You're not getting that impact from it. So getting a mix of the two is great. I think it's definitely important to have some of that impact in that safe way.
Yeah, that was actually one of the questions. Can you specify like how deep is deep water? I mean, what are we looking at here?
So everyone's different because we're all different heights. But a typical community pool is about 3.5 feet deep for their shallow and about 12 to 14 for their deep end. So if you want to do water jogging or any exercises where you're not touching the ground at all, go to where you don't touch. But if you want the impact sounds like a bad thing. It's not. Like if you want to be in the shallow, then you can go to where you can touch water is about either chest height or a little bit lower. When I taught water aerobics, I usually stood where it was like about here to me. Because A, they could see what I was doing, and B, I was getting more impact that way.
Awesome.
Yeah.
Perfect. That was a good question. Okay, and then Hannah was mentioning that in the condo pool, there's sometimes like even, float, oh my gosh, what is the word?
Dumbbells?
Yeah, like, but what is the word? Floating dumbbell, foam. That's the word I'm looking for. Foam dumbbells or something like that. So that's something else to consider. Like if you have a community or condo pool, it also brings like fun into it as well to have like those floaty devices and things like that be incorporated. So
yeah, and you can use it as like, so a foam dumbbell or a pool noodle can be an extra challenge if you're in the deep and cannot touch. So you can use it as like a way to engage your core more. By like, one thing I liked to do was hold the dumbbell or the noodle and kind of stir the other way. And you're having to keep yourself afloat with that movement, but also engaging your core. It's really fun that way. So yeah, I really liked using it for other things. And a noodle can also work in similar ways to a dumbbell. In like if you're doing a bicep curl, you can use that with a pool noodle that increases that resistance, those kinds of things.
Awesome. I got some comments on my audio. I was using my earphones, so hopefully this is a little bit better. Suggestion also is you can use half-gallon empty milk jugs as well, which is a good idea. That's fun.
That's a very added challenge right there.
I love getting creative in the pool. Marsha's wondering if there's a pedometer that she can wear in the water to chart distance because she likes, walking and running in the pool.
So as far as like a water pedometer, I know I've been looking this up for her. So you can use like there's Fitbits and stuff that you can use that just track your steps, but it's not necessarily going to track the miles. But I don't know, sometimes when you're in the deep water, it might track it a little bit differently, so it's a little bit off. Sometimes for that activity, I prefer to go based on time over exact steps, and you can always convert it. But I have not yet, I'm still on the search, Marsha, found a water pedometer. So I'm on the hunt.
Awesome, thank you.
Yeah, she's this person said Apple Watch does great job in the pool when doing water aerobics. So Apple Watch. with your new iPhone, Marcia.
Mary was wondering if we could email out that list of exercises with explanations as well for each one. So maybe that's something like,
I can try doing.
yeah,
It would have to be like Monday that can go out.
that's okay.
Yeah, and so I was thinking today, which was a little late, of doing like the exercise chart and listing it as like you can do these things amount of time with it, and kind of setting it up as like a list of exercise that they can just grab and go. So I'll set it up as exact workouts
Okay.
that they can do as well.
Yeah, and like we mentioned, Linnley is hosting a big 5K this weekend. So this follow-up email normally would come within 48 hours, but we're going to extend it to Monday or Tuesday, just so you guys are aware. Wonderful question, though. We do have lots of time. I mean, I think we're going to end early today, which is also good.
That's fine.
we do have time if anybody else wants to ask a question. I think one thing to consider, we kind of talked about infections beforehand. In the age of COVID and immunocompromised patients, I mean, what kind of advice do you give to people, when you were doing this, who are in active treatment? I mean, should they even really be going to community pools? What's the best? What are suggestions? Do you know what I'm trying to say? Like, how can they be preventative but still participate?
If it's an extremely packed full community center class, don't go. Honestly though, a pool is probably safer than a gym, because in order to be open, the pool has to have specific standards of chemicals, and those chemicals are rated hourly, and if it's not spot on, they change them so that they can remain open. So they maintain those chemicals at a certain level, and all pools that are in community centers that are open have these UV filters that filter out viruses at an extremely high level. This was way before COVID that these happened. So in the age of COVID, honestly, I feel like a lot of pools are probably safer, but that is each person's judgment. If you feel you are a very high risk person and you are worried about it, don't go. If you're not super high risk and you go in with a mask, and then when you're in the pool, you remain distant from everyone, I think you will be great. My big advice, if you go to a pool and it really smells high of chlorine, don't go in. That is too high of a chlorine level and can be damaging to your skin and swimsuit, and it's just not pleasant. And it also means that there's a higher bacteria level in the pool if it's a super high smelling chlorine. So if certain hotel pools really have that, most community pools do not. But if it's like hits you and it burns your eyes as you walk in, don't go. It's not safe. But yeah.
Awesome. And then one more time about the port for those that didn't hear the first answer. About the port, why it's not safe with the port.
So about the port, it's best not to go with a port because there is a risk of infection because it is an open area. Most doctors say don't do that. There are like patches that you can place over ports, usually up here. Usually a patch that you can do that's sealed, but it's a risk of an infection and I wouldn't recommend it. Most doctors say don't. So based on doctors' recommendations, yeah.
Yeah, that makes sense. Awesome. Well, I think we'll finish up then and let everybody go for the night.
Perfect. All right, our next HealthTree moves for Myeloma chapter meeting will occur on July 6th, 2022 at 7 p.m. Eastern. We are looking forward to hearing a patient's fitness story and learning from each other.
Awesome. Thank you, Linnley, and thanks for all your preparation for this. It was a great event.
Thank you.
You may be interested in other myeloma community events we have coming up. On the 7th is our financial chapter. We're going to be doing a medical appeals insurance workshop. On the 8th is our Connect with the Myeloma Crowd chapter. We're going to be, that says water aerobics, but that's obviously what we're doing today. I will fix that. You can see how fast we go sometimes trying to get all of this done. It's going to be tracking your myeloma labs in HealthTree Care Hub with the patient experience team. That way you can keep track of your labs and really understand what they mean and be able to have educated conversations with your doctor. And then that night is our stem cell transplant chapter. And we're going to be talking about the role of allergenic transplants in myeloma with Dr. Farrow. Allergenic transplants are when somebody else donates their stem cells, in this case to you. It's normal outside of other cancers besides myeloma where autologous stem cell transplants are usually occurring. So we're going to learn more about that. And I'm excited. The link to sign up for any of those events and even more events I didn't mention is found at the bottom of the slide. And it will also be sent out in our email that Monday or Tuesday once we've had a chance to get all this information together to share with you. Another thank you to our sponsors, Western Myers Squibb, GSK, Genentech, Janssen Oncology, and AbbVie. And a big thank you to each of you for joining us. And we hope that you have a great rest of your night. Thank you, everyone. Take care.